You're listening to the Beyond the Thyroid podcast. I'm your host, Dr. Dana Gibbs. I'm an ENT surgeon and hormone specialist. For years, I struggled with my own unrecognized thyroid problems before and even after I was regularly performing thyroid surgeries. Then, one day, I learned something that turned my health around and opened my eyes to the limits of mainstream medicine in treating more subtle thyroid abnormalities. I spent the next 20 years fine-tuning my hormone expertise in disorders like Hashimoto's disease, perimenopause, and stress-related illness. Come join me as I share this new approach to hormones that empowers you to take control of your own thyroid and hormone imbalances. Let's dive in. Today on Beyond the Thyroid, our topic is going to be Graves' disease. And this is a topic that is not often discussed in detail, but it affects a lot of people. Graves' disease is an autoimmune thyroid disease, and we're going to cover what it is, how it's traditionally treated, and how I, as an integrative physician, approach the management of Graves' disease a little bit differently. So whether you've been diagnosed with Graves' disease or know someone who has, or you're just curious about thyroid health, this episode is going to be for you. So let's dive right in, because I want you to start by understanding what Graves' disease is. So Graves' disease is an autoimmune disorder that generally causes hyperthyroidism, which is overproduction of thyroid hormone in your body. So the immunoglobulins that are produced in your blood cells that are not attacking exactly, but targeted against your thyroid gland, act just like TSH, and TSH is thyroid stimulating hormone. So the autoimmune attack causes stimulation of your thyroid gland, just like what TSH would do. And what this does is, even though you may have very, very low TSH, your body, including your thyroid gland, is going to overproduce thyroid hormones due to those antibodies attaching to your thyroid gland. Now, those antibodies are not just attacking your thyroid gland, because the receptor, the TSH receptor, is not just present in your thyroid gland for some very odd reason that is not really known. There are also TSH receptors in the tissue around your eye sockets and in the muscle tissue behind your eye sockets. So the muscles that move your eyes. So if you have very high levels of this thyroid stimulating immunoglobulin, it will get into the tissue around your eyes and build up in there. So that's very odd and very interesting, but it's an effect that happens with Graves' disease. So typically, thyroid hormone production, is controlled by your brain, by the hypothalamo-pituitary thyroid axis, by the production of TSH, or thyroid stimulating hormone. And in Graves' disease, this system, which has a nice on-off switch, gets bypassed, and it leads to unregulated high production of hormones. So what happens is that somebody will feel fine, and then all of a sudden they'll notice that they have rapid weight loss, that they have an irregular heartbeat, that they have heat intolerance and are sweating too much. They may be having anxiety or irritability, because that's what too much thyroid hormone does in your body. It can cause you to have tremors in your hands. And then because the antibody goes in and attaches to those TSH receptors in your eye sockets, you also get eye tissue inflammation that can lead to something called lid lag, where your eyeballs are too far open and you can see white above the colored part of your iris. It can also lead to eyes that begin to protrude out of your head, and we say your eyes are bulging. Well, it's not your eyeballs that are bulging, it's that they're being pushed forward by the swelling and the infiltration of those antibody into the muscles behind your eyes. It can cause vision discomfort, visual acuity problems, and difficulty closing the eyes. It can also cause what's called lid lag, where your eyelids are abnormally too far open, even if your eyes don't protrude. Another thing that it can do is it can cause deposition of antibodies in the tissues of your legs, in the fascia tissue, leading to what's called pretibial edema. And that is swelling that you can't squeeze out with like compression stockings or something. But anyway, when you go to the doctor, if you have symptoms of hyperthyroidism, you go to the doctor, they're going to do some lab tests and they're going to say, well, your TSH is low, below normal, and your free T3 and your free T4 are quite high. And if they also do antibody testing for those thyroid stimulating immunoglobulins, that's the TSI test or the TRAB test, then they will find those antibodies. And a diagnosis of positive TSI or TRAB confirms a diagnosis of Graves' disease. If you do a sonogram of your thyroid gland, then what you may notice is that your thyroid gland is enlarged and it has increased blood flow, and it also might have a ground glass appearance. That's a typical thyroid ultrasound appearance that they may say. A doctor may also order a radioactive iodine uptake test on you, which is where you actually take a pill, you swallow a pill, and it has a little micro amount of radioactive iodine that they can then measure with a specific kind of scan, because the thyroid gland, if it's overactive, will be grabbing up all the iodine to make more thyroid hormone out of it, even though your TSH is low. And that's another thing that confirms the diagnosis. So there are several treatment options that I want to talk to you guys about. And the first one is medications, because when you first find out that you have hyperthyroidism, you might have a very rapid heartbeat and a very high blood pressure. And this is dangerous, and it can be called thyroid storm. Thyroid storm is caused by high thyroid levels of any kind, and it can be thyroid that you took. It can be hyperthyroidism from another cause, and it can also be Graves' disease. And the first thing that they want to do is they want to treat the rapid heart rate and get your blood pressure down. And they're going to do that very frequently. They're going to do that with an antihypertensive medication called a beta blocker. They are also going to try to slow down the production of the thyroid hormone. And there are two medications. One of them is called methimazole, and the other one is called propylthiouracil. And both of those will block the TSH receptor and help reduce the hormone production. However, there are, particularly with PTU, there are some potential side effects such as liver toxicity and something called agranulocytosis, which is a low, very low, dangerously low white blood cell count. And so taking those medications for some people on a longer term basis is a reasonable option. And for other people, it's not, because if you take methimazole, for example, and it pushes your thyroid hormone down, if it pushes it down too far, you're going to feel horrible and you're going to feel like you have hypothyroidism and you're going to gain weight. And people don't like that. And so many of the patients who are given this medication don't want to take it because they feel worse. They feel tighter. They feel like they're gaining weight. They feel all the symptoms of hypothyroidism. And so I have seen this on multiple occasions where people who could otherwise be well controlled don't want to take that medicine because it makes them feel bad. It pushes their T3, which is the active thyroid hormone, down even farther than it pushes the T4. And so even if your TSH looks like it's in the normal range, you might feel like you're hypothyroid. And I've talked many, many times about what we do for people who have normal TSH and feel like they're hypothyroid because their T3 is low. But there are two other ways that we treat Graves' disease, and one of them is radioactive iodine therapy. So when I was talking about that thyroid scan that you can get, I said they give you a little micro dose of radioactive iodine. Well, if they're going to destroy your thyroid gland, then they give you quite a bit higher a dose of radioactive iodine therapy, and it will destroy most of the function of your thyroid gland and reduce the effect of having those high antibodies in your body. It does not take care of the autoimmune disease. It doesn't take away those antibodies. It just stops the hyperthyroid problem. But then, of course, you've still got to treat the hypothyroidism that results when you have destroyed your thyroid gland. And furthermore, it does not take down the antibodies. So then the third traditional treatment is removal of the thyroid gland. And if someone has Graves' disease that cannot be controlled with a medication, this is actually my personally preferred way to take care of it. Now, keep in mind, I was a thyroid surgeon for years and years, and so I'm very comfortable with this treatment. So removal of the thyroid gland, especially if the thyroid gland has grown quite large, or if you're intolerant to the medication, or for some reason you don't want to take radiation, imagine that, somebody might opt for having surgery if your hyperthyroidism from the Graves' disease is not controlled. If you remove the thyroid gland, there are, of course, risks to surgery. There are risks to the other glands that are nearby, like the parathyroid glands. There's also a considerable amount of one-time risk to your vocal cords as they're doing the surgery. And so you never want to pick somebody who just does a couple of these a year. You want to pick somebody who does thyroid surgery every day of the week to have your... It also, of course, leaves a scar, but that's fairly minor as far as considerations in my book about whether or not to have thyroid surgery. But one thing that thyroid surgery does that the radioactive iodine therapy doesn't is because it removes your thyroid gland, it removes the target of those antibodies, or mostly removes the target of those antibodies. So it allows them then to fall, because when your autoimmune disease is looking out for and attacking a particular tissue, once it doesn't have anything to attack anymore, it will fade away. Now that's not the only way to get an autoimmune attack to fade away, but as long as you have a really riled up, hot thyroid, that is going to be a big consideration. So we mentioned earlier that there is a thing called thyrotoxic crisis or thyroid storm, and this is caused by untreated Graves' disease, and the symptoms include high fevers, rapid heart rate, high blood pressure, and can lead to confusion and even loss of consciousness, and heart failure and cardiovascular collapse. So if this happens to a person, they will need to be hospitalized immediately and treated in an ICU until the high thyroid effect goes away, which is why it's so dangerous to stop taking your methimazole or your thyroid suppressing medications if you know you have Graves' disease. But there are other ways to do it, because none of these that I've mentioned so far are really super satisfactory. So what else can you do? Well, once you get your thyroid hormone levels under control, you can use the same techniques that we use to stop or slow down Hashimoto's disease to help reduce the antibodies for Graves' disease. So for example, stress management, meaning coaching, mindfulness, yoga, all help reduce autoimmune flares. An anti-inflammatory diet that focuses on lean protein, healthy fat, fruits and vegetables, and avoids excess iodine can prevent worsening thyroid issues. Supporting your immune system with selenium also reduces thyroid antibodies, and then probiotics to help balance your gut health and reduce inflammation. And then one more technique that I want to discuss that I particularly use, I have found to be very, very helpful and allows people to stay on their methimazole, avoid having to have surgery, and helps their antibodies go down. And that's called what I call suppress and replace. And what this is you take your anti-thyroid medicine, like your methimazole, to suppress your overactive thyroid, and you get your TSH to start coming up into the normal range, or even let it go a little bit high. And then you add low doses of thyroid hormone replacement. In particular, I start with T3 alone, but I generally will use a combination of T3 and T4 in a balanced way that I have mentioned before, so that our T3 ratio is above 10, but less than 14. And once I get that balanced replacement, then the person will feel well instead of exhausted, and they will feel energetic instead of sluggish and overweight. Their hair will grow back. They'll stop feeling cold all the time. They'll stop having low blood pressure and feeling faint. So it really prevents the fluctuations of the hormone and offers more fine-tuned control, while you're also doing the other immune system support so that the antibodies fade down. For some people, this works very, very well. For some people, they are not able to keep the flares from happening. And every time they get a stressful event, their hyperthyroidism will flare up again. That is the kind of person where a more permanent management technique, like removing the thyroid gland, is recommended. So if you have not had your thyroid gland removed, and even if you have, you're going to need regular monitoring of thyroid hormone levels, because you are then dependent on thyroid medication. So if you've had surgery, then you're not going to have a risk of recurrence. If you have had radiation, or if you have medication that you take all the time, you can be in remission, but then you also have basically a constant risk of recurrence. And so once a year at least, you're going to need to have thyroid labs and a medication adjustment. And also, of course, if you ever start having symptoms of hyperthyroidism again, then you would need to come back and get labs right away. And so thinking about this, proactive management of the condition is really, really key. So there are lots of quality of life impacts from having Graves' disease, because if you have persistent high antibodies and you're going to have vision problems that progress from that, there are now modern medications that are actually anti-thyroid stimulating immunoglobulin. And the reason to take those would be to prevent thyroid eye disease. And that is a very new development medical-wise. And not everybody knows about it. Not even every doctor knows about it. But it's super, super helpful, and much better than the old-fashioned kinds of eye surgeries that we used to have to do to try to make more room inside your eye sockets so that your eyes aren't being pushed forward out from under your eyelids. There are also mental health impacts, especially if you are on standard thyroid replacement with T4 and not on a suppress and replace regimen where you have a balanced T3 and T4. You may have anxiety, stress, and self-esteem issues. You may have a mental health impact with depression. You may have uncontrolled weight gain or fatigue. And those are indications to me that your thyroid is not properly balanced. And so I do encourage people to seek proper care as far as that goes. So this is a lot today that we've covered about Graves' disease, from what it is, how it's traditionally treated, how an integrative approach offers a more comprehensive path to healing, because Graves' disease can be overwhelming, but with the right approach, it can be managed and you can live a healthy, fulfilling life that is not dominated by your disease. So if you know someone who's dealing with Graves' disease, I encourage you to keep asking questions and stay informed and explore all your treatment options, both traditional and integrative. Thanks for tuning in, and if you found today's episode helpful, please share it with somebody who might benefit from the information. And if you like what you're hearing, don't forget to subscribe. And I'll see you next time as we continue to explore thyroid health and beyond. If you're looking for help with your Graves' disease or other thyroid imbalances, and you live in Texas or Iowa, as at the time of this recording, I am accepting new patients, and you can find a new patient application at www.danagibbsmd.com. All right, have a great rest of the day. The thyroid. If you found this information valuable, it would mean so much to me if you'll take a few seconds and give the podcast a 5-star review. It helps other people who need this information find the show, and it's really easy. Just search and click on the name of the show, Beyond the Thyroid, and scroll to the bottom to ratings and reviews. I truly do read and appreciate every one. Remember, when it comes to hormones, there will always be more to discover. So follow the show so you get the next episode as soon as it's released. And if you or someone you care about needs a caring doctor to help figure out how to heal hormone problems that other doctors have dismissed, check out my website at www.danagibbsmd.com. And if you're not a physician, please keep in mind, while I'm a doctor, I'm not your doctor. The content of this podcast is my opinion, and it's for educational and entertainment purposes only. This is not meant to be individual medical advice, and you should consult your own physician for any medical issues or diagnoses that you may have. I look forward to continuing this journey with you beyond the thyroid.